started here in just a moment. Okay, welcome everyone. I'd like to introduce Michael Wass. He has been with us before a couple of years ago to do sessions on Medicare and Social Security. Today, our session is going to be on Medicare basics. And I think 2 weeks from now, we'll be doing one on Social Security. So keep an eye out for that one as well. And Michael's been a great help to us and to many of the employees or retiring employees we've had. So welcome, Michael.
Thank you very much, Wendy. Well, it's good to be with all of you again. Some of you probably saw many of these slides. They're basically the same, although they've been updated for the 2023 indexed benefits, which do change annually. And there's a couple other little twists in there, but it'll be a repeat for you, perhaps, and for the rest of you, this will be new. I'm glad I can share with all of you. I've done this now for about 10 years. I retired 10 years ago from a regular career as a employee benefits consultant. And then when I retired, as I'll tell you later in the presentation, it's important for you to have a plan for when you retire to do something actively that gives you a reason to get up in the morning. If you think you're just going to golf or fish or whatever your interests are now, you get bored and you don't get real meaning from those. The real meaning comes from helping people. And so I encourage you to do that. And that's one of the reasons that I'm here this morning. So Medicare is a complex subject, but like anything else, once you understand it, it doesn't seem so complex anymore. And that's why we're going through this presentation today. So we'll answer your questions. And if you do have questions, you can enter them on the at the bottom of your screen, and Zach is going to collect those. We'll answer those at the end of the session. If you have other personal questions, I'll be more than happy to help you with that too. And I'll share my email address at the end, and you can send me an email, and I promise that I'll respond to you with a pretty good answer anyway. So today we're going to study Medicare, and I lumped everything into number one. It's just basic information about Medicare rather than just listing all the details of what you're going to learn. But I think you'll come away with a good understanding of what Medicare is and what you can look forward to and how you can enroll. I'll also provide you resources to help with Medicare decisions, how to choose the various plans, what the differences are, and some of the mechanics, actually, of going through the enrollment process. It is important to be aware of the enrollment timing because there can be penalties if you're late, and the penalties are substantial, as we'll talk about in a little while. So, and they're lifetime. It's not just a one-time penalty. It's in addition to your ongoing premium for the various Medicare programs. So what is Medicare? It's actually health insurance. It's a health insurance plan for people who are over 65. It also is a plan that can provide health insurance for persons who are under 65 if they have long-term and continuing disabilities. It also specifically provides benefits for anybody that has kidney disease and they end up with what's called end-stage renal disease. We're not going to talk about Social Security disability or end-stage renal disease benefits today. The benefits themselves are basically the same, But what we're talking about today is obviously Medicare for persons who are over 65. Who administers Medicare? There's actually two bodies that do. One is the overreach of Social Security itself, but under Social Security is what's called the Center for Medicare and Medicaid Services. And they're actually the federal organization that administers Medicare. There's 4 parts of Medicare, A, B, C, D. Each of these are separate. Some of these are automatic. Most of them are voluntary, and you have to pay premium to participate. Part A is hospital insurance, and that is automatic, basically, if you've worked for your career. Part B is medical insurance. It includes physicians' expenses and other miscellaneous services. Part C is interesting. This was a new program or part of Medicare that was added a number of years ago. It's like an HMO, and it was to provide a managed care option through Medicare. And then the last that is listed there, Part D, is a prescription drug program, which was finally added only about 15 years ago. Before that, there was no prescription drug benefit within Medicare. So we're going to talk about each of these respective parts in detail so that you'll understand what they are. We also want to talk about when you enroll in Medicare. You don't actually have to be retired. All you have to do is be age 65. Your initial enrollment period is a 7-month period that starts 3 months before your 65th birthday and ends 3 months after. It's automatic and guaranteed if you enroll during that period. However, many of you are going to work beyond age 65. That's very common today. I did. And so you don't necessarily want to enroll in Medicare, and you want to wait until you're going to be retired, when you're going to lose your group insurance. So there's what's called a special enrollment. If you continue working beyond age 65 and you're covered by your employer's group insurance, then you can enroll anytime after age 65 when you finally decide that you're going to stop working. The example I love to share is I once enrolled a couple who were both 93 years old, and she was finally retiring from the San Jose Unified School District. She continued to work until she was 93, and her husband was insured as her dependent husband. And so I had the privilege of enrolling them in Medicare and a Medicare supplement plan. There are other potential times you can enroll based on certain insurance company offerings. But if you don't basically conform to this either the enrollment within 7 months of your, or excuse me, 7 months of your 65th birthday, or when you cease working, you're going to pay a penalty, and that penalty is 10% of your ongoing premiums for life. And it's 10% each year. So if you wait 2 years, you're going to pay 20% additional premium for your Medicare programs. And you don't want to do that, obviously. For Medicare Part A, as I mentioned before, you automatically are enrolled if you are in Social Security already, if you filed for your Social Security retirement benefits. We'll not talk about that today. We'll talk about that next week. But they enroll for you, and they send you an ID card. You just all of a sudden get it in the mail. It's kind of a surprise. The standard period is, as I mentioned before, 7 months before and after your 65th birthday, or when you are ceasing your work. If it's not automatic, then you need to physically enroll. And you can do so by contacting Social Security, or you can enroll online, which is the way that I suggest you do it. And in the handouts that you're going to be receiving, there's actually instructions there on how to enroll online. Very simple to do. You just go to Medicare.gov, click the buttons, and it takes you through a series of screens. Takes about 10 or 15 minutes, literally is all it is, and you're all set. So very simple to do. You'll receive an ID card. This card was updated just a few years ago. Before that, it was a chintzy little paper card that got wadded up in your wallet. It was not laminated, and it included your Social Security number, which we all want to safeguard our Social Security numbers. So the last thing we really want to do is have a document in our wallet that has our Social Security number. So finally, Social Security and CMS agreed, and they issued a new ID card, and you now have instead a Medicare ID number, which is on your card, and that's the ID number that you use for all your Medicare going forward. Medicare brings with it a series of decisions that you have to make. Remember, there's parts A, B, C, and D, and there's even more decisions than that we'll go over. So you need to understand what those decisions are going to be for and which one, obviously, you want to choose. Some of the decisions include whether you want to take what's called original Medicare or Medicare Advantage. I mentioned Medicare Advantage is Part C. Part C and D were not original Medicare. Only A and B were originally passed back in the 1940s. And so that's why it's referred to as original Medicare. But that's a decision that you'll make. You also will decide, do you want to take Part B for medical insurance? It's voluntary. You pay a premium for it. So you have to make a choice and have to physically enroll if you want Part B. And then the second decision is, when do you want that to apply? Part A is automatic, and you might get enrolled for that with not even trying. And then later you have to add Part B. So when would you want to do that? What about prescription drugs? Do you want to include prescription drugs in your benefits? I strongly suggest you do, but everybody doesn't. It is voluntary, and it costs an additional premium. And then the last decision I'm listing here is whether you want to take a Medicare supplement or Medigap policy, as it's also referred to, instead of Medicare Advantage. The best way to describe the difference is Medicare Advantage is like an HMO. For those of you perhaps who have enrolled previously and enjoyed being in the Kaiser programs, that's like Medicare Advantage. And Kaiser does have a Medicare Advantage plan that you can continue once you retire. If you prefer a PPO style medical plan, then you should sign up instead for what's called a Medicare supplement or Medigap policy, which allows you the freedom to self-refer to physicians and choose any physician that you want to go to. Original Medicare, as I mentioned, included Part A and B. It includes hospital insurance, Part A, which includes inpatient care, skilled nursing care, home health care, hospice care. Part B, which is voluntary, remember, covers all other medical services, physician services, outpatient, labs, durable medical equipment, preventive services. That's all Part B. And if you don't enroll in Part B, those expenses won't be covered. Part A has no cost. It's premium free, but I add that little question there, really, because you have paid payroll taxes for your entire career into the federal government, and they've been substantial. And those actual payroll taxes is what has paid for your participation in Part A. So there's no new premium that you continue now. Once you enroll, there's no additional premium because you prepaid your participation in Part A. Remember, though, as I said before, if you don't enroll when you're supposed to, there is a 10% annual lifetime penalty. So it's important that you enroll when you're eligible. These are the details of Part A. Part A is not 100%. Part B is not 100%. None of these are 100%. They all have copays and deductibles. And this is a description of what your out-of-pocket expenses would be in Part A for hospital coverage. Your first 60 days in the hospital, there is a $1,600 copay when you're first admitted, but there's no coinsurance after that. After 60 days, then you pay $400 each day. And then if you stay as long as 90 days, then your costs are $800 a day, but there's a lifetime reserve. You only have 60 days of that benefit. And then if you stay longer than 150 days, actually Medicare pays nothing. So you would be out of pocket all of that expense. That's why we recommend that you also enroll in a Medicare Advantage or Medicare Supplement, because it will help pay for these out-of-pocket expenses. Skilled nursing care is included. For the first 20 days, it's no cost to you at all. For the starting the 21st day, it's $200 a day. And after 100 days, if you're still in the skilled nursing facility, Medicare pays nothing. However, if you had a Medicare supplement plan, it would pick up most of those expenses. So the question comes, do you need to enroll for Part A? You want to consider, are you going to be automatically enrolled if you already are enrolled in Social Security? Consider it's premium free. You don't have to pay additional cost after you enroll. However, if your work history isn't sufficient, if you haven't worked for 10 years, you can actually buy in to Part A. And probably none of you will have to do that, but it is an available option. As I mentioned, there's a penalty if you don't enroll, so you want to be sure you enroll on a timely basis. And then if you want to enroll, you simply contact Social Security, and the best way, as I said, is to do it online. You can do it over the phone, you can do it in person in the Social Security office, but the easiest way is to do it online. So the question is, do you need to enroll for Part A? Yes, you do. Absolutely, you do. So Medicare Part B. This, as I said, is miscellaneous services and physicians' expenses. There's a premium because it's voluntary. Your premium is income-based. So all of you listening to this webinar this morning are not going to be paying the same premium. It's based on your income. And interestingly, it's based on your income 2 years ago. It's your filing 2 years ago. So in 2023, it would be based on your income tax filing in 2021. Once you enroll, your premium potentially changes each year because they look back 2 years again and determine what your income was, and then they adjust your premium based on where you fall in the premium chart. Part B also includes a deductible. It's a simple plan because it has an annual deductible, and then it pays 80% of your ongoing medical expenses. You're responsible for the deductible each year, and you're responsible for the 20% coinsurance. The $226, as well as the other dollar items for copays that were on the previous slide, are all indexed, as I mentioned earlier, and they change every year based on the cost of living. So what they are today, I guarantee they won't be next year. And you receive a notice in the mail of what those changes are. They don't change significantly. They usually just go up a few dollars. Interestingly, this year, the $226 deductible decreased from what it was. It's the first time I've ever seen that. And it went down. Before that, it was $234, and it dropped down to $226. I'm sure that won't happen for 2024. It's going to go up again. This is a chart of the premiums for Part B, and you don't have to memorize this. They're in the handouts that you'll receive. There's a chart just like this, so you can look at it in detail. but just look down. The first column is individual tax return. The second column is a joint tax return, and just find where your income was 2 years ago. And then over to the right, that's what your monthly premium would be in 2023. If some of you are going to retire and enroll in Medicare this year, that would be your premium. If you're not planning to retire and enroll in Medicare this year, then that premium dollar amount probably will be higher by the time you're ready to enroll. Once you enroll, you are directed as you enroll either to pay the premium by direct withdrawal from your bank account, or if you're already enrolled in Social Security, these premiums will be deducted from your monthly Social Security check. Or if you don't receive Social Security and they're deducted from your check when you begin Social Security, then it will transfer over and become deducted from your monthly Social Security check. So the question again is another decision for you to make. Should you enroll for Part B? So if you have medical coverage already through InfoBlocks, you may want to delay Part B until you're ready to actually retire. As a side note, an employer cannot entice or offer you to enroll for Part B in Medicare so that you're not on the InfoBlocks group insurance plan. There was a law passed for that. So even if you do enroll, then interestingly, Social Security comes back to your employer, to InfoBlocks, and asks to be reimbursed through the group insurance plan. So there's no way around it. So if you're still working, do you really want to enroll for Part B? Probably not. There's no real need for it. You have a good coverage, and you don't need to pay the additional premium that you would pay through Medicare, and also pay whatever your contributions are for the InfoBlocks plan. However, if you don't have medical coverage, or when you're ready to retire, then you don't want to pay for all your ongoing medical expenses out of your own pocket. Plus, you want to remember, you don't want to be a late enrollee thinking that you can do without and later find that you can't, or if you overlook it and just fail to enroll on a timely basis. So if you don't have coverage through your employer, then yes, you definitely should enroll for Part B. Then the next question becomes, we've talked about Medicare Advantage, we've talked about Medicare Supplement. Which of those is really best for you? And that has to be your individual decision. The benefit plans are all substantial, but they're different, and the premium costs are different too, as well as the type of care you receive. Do you prefer managed care, or do you want to use a PPO that is more flexible in how your medical care is administered? First, we'll talk about Medicare Advantage. Medicare Advantage, remember, is what I said is like an HMO. It's not an HMO, and there actually are PPOs through Medicare Advantage too. But principally, it's HMO style plans. They definitely are part of the Medicare program. They are administered by private insurance companies. This is not administered by Medicare. So in every zip code across America, there is a series of plans that are available in that local region. Those plans are different. The benefits are different. The sponsoring companies are even different. So it's all based on where you live and when you're ready to enroll. If you enroll in one plan and then you later move, you will have to change and choose a new Medicare Advantage plan in whatever the new location where you're going to live, because the old plan will not provide coverage for you there. These are network-based plans, so you must use the physicians and the hospitals that are included within their respective networks, and that's one of the reasons that they are region-specific. I like to describe this best as, since you're so used to many of you being insured by Kaiser, Kaiser does offer an excellent Medicare Advantage plan. And so you can simply call Kaiser when you're ready to enroll for Medicare, and you would enroll for their Medicare Advantage Part C plan. Within these plans, Medicare actually pays the insurance company a monthly amount, a stipend it's called, for every enrollee, and that's true for all HMOs. You'll probably have to use their networks and doctors. Not all plans, but most plans you will. Depends on the plan that you're reviewing. And as I said, the availability is based on the region where you live. It's still part of Medicare. You have all the rights and protections of Medicare. You must still enroll for Part A and B in order to be enrolled in a Medicare Advantage plan. It may include prescription drug coverage, so you might not have to enroll separately in Part D as you would if you selected a Medicare supplement plan. It also includes some enticements for you to join their plans. Many of the plans include vision or dental. They're limited plans, very limited, but they are included. Some even now include hearing aids, and it's all for the same premium. So there is an advantage if you want to use those facilities, but I will caution you that it does require you, again, to go to specific providers for these types of care. You can't just choose to go to the audiologist or the ophthalmologist that you already are seeing now. And again, as I mentioned, it's in-network benefits. You have to stay within a network to provide most of your care. And it is different based on the region where you live. So to enroll in this, again, just as we talked about earlier, there's a 7-month period before and after you turn 65, or a special enrollment when you actually terminate from Infoblox and are ready to enroll for Medicare. There's also an open enrollment period every year that runs from October 15th to December 7th. And those of you who are already 65, or if you're approaching 65, you are inundated by advertisements from all kinds of Medicare Advantage plans, and particularly prescription drug plans. And anyone who thinks that our personal information is confidential, you well understand that it's not, because all of these advertisements are mailed to you with your name, and they obviously know your date of birth. So that is all general information that's in the cloud that is used for all these mailings. But the advantage of that open enrollment is that once you enroll in a Medicare Advantage plan, or for a prescription drug Part D plan as well, open enrollment every year means that you can change plans. So if you enroll in one plan and you decide during the year that you don't like that, then come open enrollment the following year, you can simply transfer to a different Medicare Advantage plan or a different Part D prescription plan. So to enroll, you simply call the respective Medicare Advantage plan that you want, or you can use the Medicare Plan Finder at medicare.gov, which once you put in your zip code will list all the available Medicare Advantage plans to you, and then you simply enroll online. Again, an easy way to do it. So again, it's a decision. Should you join a Medicare Advantage plan? Remember, you have to have Part A and Part B to join. You must live in the service area. You can't be in kidney failure. Most plans do have comprehensive coverage, and some of them include Part D prescription drug benefits. It will probably be a network-based plan. You'll need a referral from a primary care physician to see a specialist. You can only join or leave the plan during certain periods, and that's open enrollment generally. And you might still want to consider option for a Medigap or a Medicare supplement plan if you don't like the managed care style plan that is generally a Medicare Advantage plan. So the question again, should you join a Medicare Advantage plan? It depends. Really depends on your personal preference. Prescription drug benefits are Part D, and these are available for anybody who's enrolled in Part A and or B. You don't have to have both, as long as you have one. Again, it's optional. You have to pay a monthly premium to participate. Again, these are sponsored by private insurance companies and drug companies. The plans vary by region. They're all different. Premiums are different, and you have to choose the one that you want. You enroll online, and you can compare on Medicare.gov website all the plans. You simply put in, the best way is for you to actually list your particular prescription drugs, your preferred pharmacy, and these are choices you make on the enrollment website, and then it will show you all the plans in your zip code that are available, and it will show two premium numbers or two costs for you to consider. The first is the annual premium for that particular drug plan, but the second is more valuable or equally valuable in that it will show you the estimated out-of-pocket for an entire year based on your prescriptions for that particular plan. So you simply add the premium for that plan and the estimated out-of-pocket cost and choose the plan, I suggest, that is the least. Sometimes the deductibles are different, but this algorithm computes all those differences and shows you what would be actually the least costly plan based on your current prescriptions. It works very well, and I suggest people do that every year. You enroll first in your prescription drug plan, but then you'll usually receive a letter in November or October that your premiums are going to go up. Sometimes your plan is going to change and they increase deductibles. So simply go back to the website at Medicare.gov and do the process all over again. See what will be the new best plan for you for the coming calendar year. As I mentioned, these plans vary by region. The benefits are set by whoever is sponsoring the plan. They all include drug formularies, and the formularies are different for each plan and each company. That's why your out-of-pocket costs will be different for each of these plans, and it'll be different for each one of you because each of you have different prescription drugs. Some of those drugs are more expensive than others. Some of the drug formularies will include it with a high copay or a lower copay. Each of them are different, and that's why it's so valuable to use that Medicare enrollment website, because the respective algorithms calculate all those differences. You'll pay a monthly premium. You'll probably pay deductibles and co-payments. And if you are in a situation where you're economically challenged, or if you know someone who is economically challenged and they need a Part D plan, there are some federal helps to pay some of these premiums for you, and we'll actually cover those at the end of this presentation. So when do you enroll in a Part D plan? Again, during your 7-month initial enrollment period, or during the annual general open enrollment period from October 15th to December 7th. And there are special enrollment periods that come available by different insurance companies at different times, but you really can't count on those. And then, of course, the best time for you is whenever it is that you decide that you're going to retire and go off the Infoblox group insurance plan. As I already explained, you simply go to Medicare.gov to enroll, and this talks about how you go through that process. Very simple, straightforward process. So again, the question is, should you enroll in a Part D prescription drug plan? And the question is, are you already covered? If you are, well, you don't probably need the coverage. If you're going to delay enrollment, you might have a penalty. So be careful of that. So should you really enroll in a Part D plan? I've had clients that chose not to enroll in a Part D plan because they said they had no prescriptions. And so they said, why would I enroll in that? And then a year later, they call me and they said, well, I've been diagnosed with a heart condition and I have a prescription that's going to cost me $1,200 a month. And that's a true story. I had a client that happened, but he had delayed and delayed to enroll for a prescription drug plan, and he was considered a late enrollee. So he ended up paying the premium for the plan he chose, but that plan was delayed until open enrollment. He called me in May, and he had to wait till the following January for his plan to begin. And when it did begin, he has now a 12% penalty. Prescription drug is a 1% penalty per month that you delay. And he delayed a month and a half, I mean, a year and a half. So he had an 18% penalty that he's paying now for the rest of his life, on top of the regular premium that he pays for his Part D prescription drug plan. So the question, should you enroll in a Part D plan? Probably. The only condition that you wouldn't would be if you're still working, but when you stop working, you definitely want to enroll for a prescription drug plan. So what about Medicare supplement? Let's talk about that next. It's also called Medigap. It's similar to a PPO, as I mentioned before. It's an alternative to Medicare Advantage. And again, it's sold by private insurance companies. And it can pay all of the deductibles, coinsurance, and co-payments that we showed on that previous slide. Most Medicare Advantage plans still leave you out of pocket with expenses, similar to the Kaiser plan for those of you who are in Kaiser now. There's usually a hospital copay, there's usually a physician office visit copay, but with Medicare Supplement, you can do away with those if you want to. Medicare Supplement is standardized, so there are a number of plans you can choose from, but each of those plans is identical and they are insured by different insurance companies. So you have plans that are offered by Aetna, you have plans offered by Blue Cross, by Cigna, but the plan that they choose, if it's the same plan ID, for example, Plan F, it's exactly the same if you choose Cigna or if you choose Aetna. The only difference is your plan premium, which is very interesting. So when you're ready to choose for this, what I do with clients is there's a website here in California through the Department of Insurance that lists all the premiums for all the plans. And so I just show that to our clients as we're enrolling, and we choose the company they want based on the premiums they are, and try to select the lowest premium with a company that they recognize, because frankly, there's 4 pages of companies, and many of these companies you've never heard of before. So I suggest that you always choose a plan that you're comfortable with, a name of a company that you're comfortable with a lower premium. And you can also change these plans every year. There's an open enrollment period, which is your birth month once you've enrolled in a Medicare supplement plan. So if you choose one company 1 year and then you get a large premium increase the next year, or for whatever reason decide that you want to change to a different company, you can do so during your birth month and every year. And you can literally change companies every year if you wanted to. However, generally the premiums are pretty much stay in perspective, and they kind of leapfrog each other depending upon when they each change the premiums. But there are certain companies that I have found in the last 10 years are more stable in their premiums. And when you're ready for enrolling in a plan like this, I do recommend you talk to a professional, and they'll help you in that process. The most popular plan is Plan F. Plan F literally provides 100% reimbursement of all the Medicare Part A and B copays and deductibles. So you walk away with the first time in your life with a program that literally has no out-of-pocket cost to you. The only difficulty with that plan now is that in January 2020, it was limited to anybody who was already age 65 by that date. Some of you on this webinar fall into that classification. If you were turned 65 on January 1, 2020 or earlier, you still can have Plan F. If your birth date is such that you turn 65 after 2020, then the next best plan is Plan G, which is actually identical to Plan F, except it does not cover the annual Part B deductible, which in 2023 is $226. So you literally have no out-of-pocket expense for any of your medical care except for $226 a year. So it actually is a very simple plan to administer and very popular among many people that I work with. This is a chart that summarizes all of the plans, standardized plans A through N. Again, these are the identical plans offered by each insurance company. Regardless of the named company you choose, your benefit for Plan F would be identical, or for Plan G. Again, there's a handout in the distribution that Wendy is providing to you that shows this chart, so you don't have to try to memorize this real quickly or find what you want to do. But it is important to know what the differences are and choose the plan that you want. And if you look at column F, if you just quickly look down the line, 100%, 100%, 100%. Everything is 100%. Plan G, 100%, 100%, all the way down, except Medicare Part B deductible is not included, but everything else is 100%. I'll also point out foreign travel. If you travel outside the United States, if you just have Medicare without either Medicare Advantage or Medicare Supplement, Medicare does not cover any medical expenses outside the United States. So you literally have no coverage. However, if you enroll in a Medicare Advantage or Medicare Supplement plan, the Medicare Supplement plans generally include it, but only, as you see here, plans C, D, F, G, M, and N. So these other plans do not include it. But if you enroll in these plans, F or G, then you would be covered for your foreign travel and you do not have to buy supplemental travel insurance. Medicare Advantage plans usually include that too, but you do have to look at the benefits specifically. I have no summary of those benefits because, as I said earlier, all those plans vary based upon the company that's sponsoring it and the region in which you live. So there is no simple summary to show side-by-side benefits for Medicare Advantage plans. Well, when's the right time to buy the Medicare or Medicare Supplement or Medigap policy? Again, consider the open enrollment. Consider when you're going to be terminating from InfoBlocks. Some insurance companies offer what are called enrollment holidays. And there's also the open enrollment period during your birth month. That is available in California and about 12 other states. However, that provision is not available in most states. So we're fortunate to be in California. If you're in another state and you enroll in a Medicare Supplement plan, then you're pretty well locked in, because the only way you can change to a different company is if you go through medical underwriting. And often, as you're in an advanced age, you've got such medical conditions that prevent them from allowing you to join their plan. So if you are going to move out of state, it's wise to check that state to see if they have open enrollment for their on your birth date for your Medicare supplement plan, or maybe you want to make a change before you actually move. So the answer is yes. Usually you want to enroll for your Medicare supplement or Medigap during your open enrollment period, either when you first turn 65 or when you terminate your employment with Infoblox. How do you choose the right plan? I suggest you talk to a professional. They'll help you with that. Or you can go directly to Medicare and choose a plan there and enroll either by phone or online, whichever you prefer. So the question, do you need a Medigap policy? Are you taking Medicare supplement or are you taking Medicare Advantage? Do you have another plan? Some employers, I honestly don't know if Infoblox provides a retirement medical plan. I've worked with people where some employers do. Government entities often do. And then you wouldn't necessarily need to sign up for a Medicare supplement or Medigap plan. Can you afford all the deductibles if you don't take the plan? There's no out-of-pocket expense limit under Medicare, just like you enjoy under your Infoblox plan. So once you reach a point on your Infoblox plan, the plan pays 100% for the rest of the calendar year. If you have a Medicare supplement or a Medicare Advantage plan, it would do the same thing. If you have only Medicare, remember that hospital expense stopped after you were hospitalized for a period of time. So you don't want to be without medical care. If you require that kind of serious care, you want to be sure that you're covered no matter how long it lasts. So do you need a Medigap policy? Probably you do. And I would suggest you enroll in either a Medigap Medicare supplement policy or choose a Medicare Advantage plan that you want. We talked before that some people are a little income challenged. They have, they could use some help to pay some of these premiums. And there are 3 entities that will help with that process. They're all federal entities. I'm not going to go into a lot of detail other than just to mention these because you should be aware of them. Probably not for you, but perhaps for another family member or friend, if they would ever need that, it's important to know. 3 different programs. The first is Medicaid. It's called Medi-Cal in California. It's actually a federal program administered by respective states for people with limited income and resources. Each state determines its income threshold and how it's administered. And all the administrative processes and benefits will vary based upon the state. There's also Medicare savings programs. These help pay your premiums and are also federal programs. And then there's also what's called Children's Health Insurance Program, CHIP. This is for children up to age 19 and can also include pregnant women. Again, it's all income-based and would be a great help for someone so that they can continue to have their health expenses covered by Medicare. These are Medicare websites for each of these programs. Again, you don't have to copy these down because Wendy's going to provide you copies of these slides and you can look back and address these at your leisure. So the key points to remember from what we've talked about so far: Medicare is a health insurance program. It does not cover all of your healthcare costs, although they can be, depending upon the Medicare supplement or Medicare Advantage plan you choose. You have choices how to obtain your coverage. There are programs for people with limited income and resources to help them pay their premiums and their expenses. It's important for you to remember your personal decisions will affect the coverage that you choose, but you do have the freedom to make those choices yourself. Some of these decisions are time sensitive, and you don't want to pay the penalties that otherwise apply. And of course, always ask help if you need it. So that is Medicare. But when I talk with people, I take a few moments just to talk about a couple other general planning issues for you. As you retire, it's kind of a punctuation point in your life, is the way I like to call it. And so it's a good time to look back and look at a checklist to see, have you done some of these things? And if not, this is a good time to do it, or do it now following this webinar. If you haven't thought of these things, these are all issues that you need to address. The first one is, I always recommend people choose a financial advisor. I'm not a financial advisor, but they will help you in your planning for your retirement. You want to be sure that you're contributing sufficient dollars to your 401k that you will, together with Social Security, have enough to retire comfortably. We'll talk obviously more about Social Security next week, but I strongly recommend everybody have a financial advisor. I mentioned earlier, develop a plan for retirement. When you stop working, you don't have anything to do when you get up in the morning unless you plan something to do. And if you're just going to be, winging it, you'll find soon that you get bored, that it's not satisfying. You need to find something that you can earn the respect from others around you, just as you do now when you're working. And by earning that respect, you will keep your self-respect, which will prevent you from going into retirement depression, which is very common. I've worked with men and women who have really struggled into retirement. They hate it because they don't have anything to do. They had meaning while they were working, and they feel that they've lost their meaning when they stop working. Legal documents, you should all have a will and a living trust. And they're simple to do. It's very important. I won't go into all the details why. I think many of you do know about them. If you have questions, send me an email following this webinar, and I'll send you some other documents that explain what these all are and the best way to have them completed. You also should have an advanced healthcare directive. This enables people who are suffering through a life-ending disease or illness or accident, and it determines what kind of care you want to receive in the end. Do you want to be sustained indefinitely, or do you want to come to an end comfortably in a safe environment? And we should all choose how we do that. My son is a physician, and he has been in situations where the family is gathered in the hall arguing whether they should stop caring for their loved one who is in a life-ending coma, and they're not probably ever going to wake up. And it's very difficult for the family, and it's also difficult for the medical professionals that are working with them. Also, a durable power of attorney for healthcare. It's a way to establish again how you want care as you grow older. And then many of you are familiar with HIPAA medical release forms, and you're always bothered because you have to sign these forms when you go to the doctor now. If you go to a new doctor, sometimes you have to update them, and often they're a copy that's been copied so many times you can barely read it. But these are important because it protects your medical privacy. However, you should be sure that you have completed a medical release form, not only for the physicians and dentists and medical professionals caring for you, but you should also complete one of these for your spouse. So your wife or your husband can talk to your doctors. If you're in an accident and you're in the hospital, the medical professionals can't share medical information with you unless there's a medical release form that's in place. So I recommend, especially as you retire, complete these forms for your spouse and perhaps one of your adult children or another friend that you trust, so that people can talk to your doctor if you're not able to talk to your doctor.
Hi,
You should
Michael.
also consider.
Michael, I just wanted to do a quick time check and let you know we have 4 minutes left.
Okay, and I'm just about done.
Okay,
Thank you.
great.
Thank you, though, for the reminder. Long-term care insurance, many of you know what that is. Call a professional, look into that. That can be very expensive if you require long-term care. Beneficiary options, one of the handouts that you'll receive from Wendy talks about this issue of how to protect your grandchildren. If you don't fill out your beneficiaries information correctly for life insurance and 401k, annuities, some of your grandchildren may not receive any benefits and other grandchildren will. So you want to be fair. So read through that essay that talks about that issue. And then the last is identity theft protection. I'm a great fan of that, to be sure that everybody protects your ID theft. I've used that, and I've been contacted simultaneously when I was on my computer, my phone, a text message, and I'm notified that someone is trying to use my Social Security to take out a credit card. And you can say yes or no. So you totally protect yourself if you have identity theft insurance. So Medicare, if it's a government program, I love Will Rogers. He made this statement, and you just always want to be sure that you're getting all the government that you're paying for. So with Medicare, you truly do.
Thank you, Michael. I'm going to go ahead and let Zach read the questions.
Okay.
Great. So we got a number of questions here. I don't know if we'll be able to get through all of them, but Michael, is it okay if I email you after and put together a short FAQ?
Yeah, if we don't get
Okay.
all of these, just send them to me. And if they're personal nature, I can answer those. If they're general, I can send the answers back to you, Zach, and you can share them with everybody.
Yeah, okay. Perfect. Yeah, so for everyone still in attendance, I'll get the FAQ together. And then Michael's email is right here on the slide in the bottom left corner. And you're welcome to email him directly if you have some more personal questions. So one question that I saw on here twice was regarding someone that has a younger spouse who's still on their employer plan, but isn't eligible for Medicare. How does that work for them, or how does Medicare work for them?
Okay. If your spouse is still working, then they probably are on their respective group insurance plan, and they just stay on that plan until they're age 65 or until they're ready to retire, and then they would enroll just like you do. If they are not working, then they would be eligible for COBRA for a period of time. In California, you're eligible for federal COBRA and California COBRA up to 36 months. If you still aren't 65 or the spouse isn't 65 at that point, then they would have to obtain an individual health insurance plan until they turn 65. And again, a medical professional a professional insurance professional could help with that process, or you could contact me. And I don't actually enroll people for that, but I provide you a website that you can go to very simply and enroll for a guaranteed plan.
Is someone able to be covered if their spouse, by their spouse, if they're still covered by their employer's plan?
Yes, you can
Okay.
insure your respective spouse as a dependent on your group insurance plan from Infoblox, and they can include you in theirs the same way.
Awesome. I think we have maybe time for one more question here. The first one that came in was, since the monthly premium for Part B might be quite high for 2 years, does it make sense to wait until you've been fully retired before starting it?
No, because if you wait, you're going to have a 10% premium penalty for the rest of your life for each year that you delay. So that is just a problem, and you're absolutely right. When you retire, your probably at the peak of your earnings. And so for the first 2 years of your retirement, you might be toward the high end of that schedule. But you just have to wait till that works down. And I do not recommend that you delay.
Awesome. Thanks, Michael. We did get a thank you in the chat view as well, for making this plain and simple. So, I do want to be mindful of people's time. So for anyone who asked a question that has your name attached to it, I'll follow up with you, after I've had a chance to connect with Michael on it. For anyone else, go ahead and send Michael an email directly, and he'll be able to get back to you.
Well, great. Well, thank you, everyone. I appreciate your time. If you ever have any questions about Medicare, give me a call. There's my telephone number, or send me an email. I'm available. This is what I do on a regular basis.
Thank you, everyone. And also remember, on the 28th at 10 p.m. Pacific time, we will have Michael back to go over Social Security. Thank you again, Michael.
Thanks,
Thank
Mike.
you. Bye-bye.